I'm Samrana Yasmin. I'm working with Sightsavers as Senior Global Technical Lead for Refractive Error. I'm based in Islamabad, Pakistan. I joined IKEA sector in 2004. And I think one of the reason I joined this sector because I myself was a kid with myopia and I could relate to the cause. I thought that I might be able to play my role just to make sure that kids who need eye health services, they can get it.
That's really nice. That's really amazing, actually. So maybe you can tell me a little bit about how that journey has been for you, and probably what's one of your favorite memories working in eye health.
Journey has been really, really rewarding and interesting at the same time. I initiated the work by being part of different projects which primarily focused on vision rehabilitation. So working a lot with children with vision impairment where the regular intervention cannot help you restore sight. So the rehabilitation aspect was really strong in my initial phase of my work. And then slowly I moved on to other areas. I love almost all of aspects of my work, but I particularly enjoy working on our school health integrated programs. And as I said earlier, because I feel it gives me an opportunity to make sure that children, particularly young girls, have access to eye care and spectacles. I believe that clear vision and healthy eyes play a huge role in children well-being and social development. So I feel that investing in their health, eye health, education, and overall well being is the best investment we can make as individuals and as a society. So, yeah, I'm just playing my humble role in this fabulous journey with everyone.
That's amazing. Honestly, it sounds like you really love and enjoy what you do, which is absolutely amazing.
Thank
So
you.
probably let's get a bit into it. Why do we say that there's a global eye health crisis, and what does that mean?
So, World Health Organization released its first World Report on Vision in 2019. And that report highlights that at least 2.2 billion people across the globe have a vision impairment. And out of this, there are almost 1 billion people who have a vision impairment which can be prevented or can still be addressed. We know based on the trends that these numbers are going to increase. We also know that women, people with disabilities, and other marginalized groups are more affected by it because they have less access to care. And in the last 18 months, COVID-19 and its long-term implication basically further aggravated this situation. So it is right to say that we are in a global eye health crisis and we need to do something about it.
How did this come about? What are the causes of the growing numbers of people who have been affected by visual impairments?
We know that uncorrected refractive error and cataract are the leading causes of vision impairment, which can be addressed if people have access to comprehensive and inclusive eye health systems and services. At the same time, the focus and priority of national governments and policymakers can be challenging because there are so many other competing priorities. So, how we can highlight the fact that eye care is high on the priority of decision makers to make sure that right resources are allocated to develop and integrate eye health services into health and education system is the way to go. So awareness raising, advocacy efforts to get these messages out that we need to make sure that people who need eye care have access to the right services is the high time, I believe.
Is there anything more that could be added or that needs to happen in order for us to tackle it?
Absolutely, a global commitment because until and unless everybody is on board to take this message forward and take this agenda forward and linking it with overall picture of universal health coverage, sustainable development goal is equally important.
And how is Sightsavers making a difference?
At Sightsavers, our principles of partnership and leaving no one behind are at the heart of our eye health and refractive error programming. We also realize that until and unless gaps in evidence and data are addressed, we won't be able to support the development of high quality eye health and refractive services. So, by applying system strengthening approach, we make sure that we engage with all stakeholders to develop the services which can be sustainable and then scaled up. And also, while we are at it, we just try to make sure that these services are evidence informed, gender responsive, rooted in local context, and accessible for all.
As my last question, what is your message for World Sight Day to anyone that's listening?
One of the key message which I want all of us to take forward on this World Sight Day is that this is a journey which cannot be achieved if we are doing our thing in silos. All of us have to play a significant role in this journey, but at the same time, collaboration, working with each other is going to be a key. So, taking everyone's view on board, most importantly, people with vision impairment and their experiences and their voices on board is something which will help us to make sure that the services which we are trying to provide are according to their needs. And for I myself being a parent, just making sure that our kids get regular eye examination, get their spectacles if they need it, use their spectacle if they need it, because that is something which will open the doors of opportunities for all of them.
Thank you.